Okay, are we connected?
Yeah, Greg, I think we are. We're connected.
Excellent. So let's get started. From the team at EdFX, we would like to thank the UHAN community for the invite to present at the 2020 UHAN Annual Forum. So let me introduce myself. My name is Greg Prothero. I'm the Senior Director of Solution Consulting at EdFX. And my business partner here, John Kelly, is Principal Business Advisor to EdFX. And like John, we've both been working in an industry for over 20 years, and EdFX is over 20 years old as well. So we bring a lot of history and a lot of experience to this. I'm so happy to have John speaking today. So thank you, John.
Thank you, Greg.
Yeah, so we like to keep your attention for this whole 30 minutes. So we wanted to bring up the key points in the first slide so we can remember these and also take away what we want to take away from this meeting or presentation. First, we like to make sure that everyone understands that EdFX is your partner, right, and a community partner at that. We'll get into a little bit of what that means. And then we'll talk about connecting health communities and what the difference is between that and what we'll talk about. And then we'll talk about EDI to API and this evolution, not revolution, that we're getting into. And then really understanding how building the right foundation at the right time will build future value into this community as a whole as we go forward. So, and then we're going to encourage everyone here to, if you don't have a plan, start building that plan because interoperability is not easy, but it does take a plan. And then hopefully get connected. That's the biggest thing. It was like, if you're not connected now, make sure we get connected. So we'll introduce EdFX here. As a healthcare technology innovator, we as EdFX has been building and implementing innovative HIT solutions really to empower healthcare stakeholders like yourselves, right, to meet the demands of this transformation of healthcare. So with over 250 customers, we process billions of transactions across the platforms, our platforms. And this really impacts millions of covered lives every day. And we take that seriously. So we are activists, we are promoters, we are doers really at our company that take an active engagement in cross-stakeholder groups. And one of the groups that are actually a few of the groups you're seeing here is the Da Vinci group, and that's part of the HL7. We're also active sponsors, and John's on the board at WEDI, and we're actively working with Karen groups and others here like CAQH Core and others, and then partners like AWS and BeWell, who we work cross stakeholders, making sure that the future healthcare models and interoperability standards are adopted and helping promote that. So take you for a quick ride for the past and into our kind of a roadmap from products, really taking kind of a data-driven, risk-driven, and value kind of approach as our customers kind of transformed in healthcare. So since 1996, right, EdFX technology has really helped healthcare providers, the insurers, agencies, pharmacy benefit management companies, and other trading partners trim their waste, reduce costs, comply with standards, really, and increase revenues and enable care. And that's all kind of figured here as you look when you look at this timeline. Let me quickly go back there, a little too quick. From 1996, we built tools like Spec Builder, where we help manage mapping and testing. We simplified that. 2006, where we came out with our engine, our X engine, so we actually started orchestrating in real time these transactions. And then when compliance hit, we started building that into our technology, right? 2012 came and we had the idea of risk and managing risk, right? So revenue integrity business solutions are now added into our portfolio. And then we got into population payment, kind of the first approach of managing business transactions or business programs at a central location. And then way back in 2016, we've already started kind of playing with FHIR, right? It started building out FHIR standards and working with Da Vinci and all of our partners to see and build these new implementation guides and use cases. So we've been building and using FHIR back in 2016 as we developed our interoperability solution. And then population health, and then into machine learning and predictive models. All of this great experience, we're bringing into UHAN, right? And so these health information networks in these communities. So by leveraging the smart trading platform, the business solutions that we're having in the ecosystem of connected stakeholders, today's healthcare networks will quickly improve current capabilities and build a foundation for new services, enable frictionless interoperability across a connected healthcare. So what is connected healthcare, right? Connecting health communications has been in HIN's past. They've been doing this for quite some time now. Over 30 years, HIN, right, or EHIN has been driving innovation, right? Building out collaboration for an inclusive, more connected healthcare community. So being selected by EHIN as a healthcare IT technology partner really just confirms our vision, our approach to future healthcare, and the technology that empowers that are both aligned, right? This will ensure that the future capabilities that we work together on will add value for the community as a whole. And we're so excited for this and the partnership going forward. John, you'd like to talk about a little bit of a connected community?
Thank you, Greg. So when we talk about connected communities, there's a phrase that all of you are familiar with. It at this point, it's become almost a cliche. The right information in the right place at the right time or for the right purpose. This is something we've been saying throughout the HIT movement. It's something that over 10 years it's taken for it to become a cliche. And yet we still struggle with that goal. We've been talking about it for over a decade, and we're still trying to figure out how do we make that happen for patients and for doctors and for payers and for everybody else involved. So when we think about where in our lives, other parts of our lives, we see that happening, I'd like to put out the idea that we live every day with something called Amazon. With Amazon, you have a platform that lives out in the ether that connects people who have something with people who need something. And when we think about in healthcare, the right information at the right place at the right time, in a sense, we have people with information and we have people who need information, and we need those people to be able to share that, exchange it, bring it together, correlate it and consolidate it in a way that creates value and benefit. And when we look about what Amazon does and we put it in the context of the broader idea of industries in general, we think of things like supply chain integration, bringing buyers and sellers together. And we like to think that healthcare is different, but I think there is something when we look at how does Amazon do this? How did they get there? How did they build that platform? What are the technologies that they bring to bear, and how have they accomplished this over their existence and their timeline? And in many ways, the emergence of Amazon correlated not too differently from the way healthcare has emerged within the HIT movement. And if we go back to 2014, when the HIT movement was in full swing, and when we had spent billions and billions of public dollars on building out HITs and thinking about meaningful use and high tech and era, there was a group called the Jasons, a government consulting group that came out and basically said, you're doing it all wrong. You're not looking at how the internet evolved. And so that's why I think it is relevant to think about what we can learn from Amazon and the methods that Amazon uses in terms of creating connected communities. But healthcare is different in many ways. Next slide, Greg. Because what Amazon doesn't do is Amazon doesn't connect buyers and sellers for a higher purpose, right? You don't have the people who need goods and the people who have goods getting together and exchange them. When they're done and the money's exchanged, the transaction's over. But when you think about healthcare, it doesn't stop there, because the reason that you have people that have information and people that need information is because they want to share that information on behalf of a patient or behalf of a customer. There's a third party involved. And we think of the third party as a third party payer, but really in healthcare, trying to put the patient at the middle, making, achieving true consumer-directed healthcare, that is about having the patient be that third party, that shared customer who providers and payers are working together to serve. Next slide. So when we think about the technology, that Amazon-type technology that has to happen in healthcare in order to make this all happen, it means that you have to have capabilities at the edge. Payers, providers, the consumers, Medicare, Medicaid, employer groups, everybody, people who are in the community of EHIN need to have capabilities at the edge of the enterprise that support and facilitate this exchange. And that's what EHIN is there to do. UHIN working with EdFX and the technology that we're helping to bring to the table is to be able to help capitalize and provide and support and enable all of those people at the edge to be able to participate in this connected community, and then thereby serving the consumer ultimately. Right now, we're working on the meat and the potatoes of revenue cycle transactions. We're trying to move forward into value-based care, but the ultimate goal that's certainly espoused by the recent rules from HHS is to put the patient at the center, to be able to bring about all of this information working together in the service of patients and members. Next slide. So what has changed to make this doable now? We've connected the systems. We've gotten to the point now where we've standardized the transactions with the various mandates that are out there with X12 and NCP, HL7CDA, and now FHIR. And we're also starting to standardize the processes with things called IGs or operating rules, or the various, determination that what I call the barter components that we use to support healthcare have been kind of mandated with US CDI. We now know here's what's available for us to build automated processes around. That's what really US CDI is. So when you think about connecting, standardizing, and then figuring out how our processes share information to work together and be able to be automatable, that's how we arrive at the connected community. That's how we bring all of the information together to create patient-centric data exchange. And whether we're providing the information directly to the members, which is part of the future, or we're sharing information on behalf of the members and patients now, which is what the work that UHIN and EdFX is doing at this point in time, that's all part of the continuum of getting to where we want to get to. Greg?
Excellent, John. Thanks so much. So we're excited to work, with the UHIN community, right, and their approach, which aligns with our approach, right? And so we have a 3-phase process that we're aligning our goals and strategies around. So the first phase would take in a modernizing, or if you will, modernizing that front end of the community, really streamlining the clearinghouse processes. And so if you think about that, some of the ideas might be adding validation up front, running a business rule up front, right? So really ensuring data quality that comes through. Really automating maybe some of these EDI processes that are traditionally not quite manual now, and then also, improving the enrollment orchestration, right? So those are a couple of things to think about, and John will go into a couple more when we talk about some of the benefits. But really, phase 1 is already kind of started, right? And the idea of modernizing the front end is, working together with UHIN and EdFX, right? Is we're going to accomplish that in the next in a year here. Phase 2, right, is the clinical and compliance, right? Putting focus into clinical data exchange and really meeting the mandates that John mentioned. So some of the things you could think of is reducing that burden, not only on the provider, but also on payer. So the administrative burden can be reduced. The idea of process automation, maybe for prior auths, right? The ability for interoperability to kind of build into this from a compliance perspective, the new APIs and endpoints, and then provider directories, provider data being updated and be used and consumable at the point of when it's needed. And then really ensuring member identity and verification on every transaction is really going to ensure making sure that the data is being moved is right for the right person at the right time. And then finally, phase 3, right? Phase 3 could be scaling for the value, right? How do you get to that value point? Well, the concept of a healthcare value management, right? Managing the value for the community as a whole. One of the things you can take a technology view, which would be, kind of the scalability around using a cloud platform, which we're already working on and discussing. But then the big focus is around the community as a whole, right? And then thinking about the member slash consumer slash patient, right? How do you do care coordination better? Do we want to use predictive analytics, machine learning here? Also, quality metrics. How are we consuming these? How are we tracking these, right? How can we do a better job at this when we're actually managing populations as a whole? So you can see there's a whole open up use cases, a lot of use cases on this stage 3 that we can get into, and we're really excited to do this. So if we were to just kind of think about key capabilities that are a part of our platform, but also at the edge, right? If you think about EDI, been around here for quite a long time, right? We're starting to adapt APIs, but really is just, patient data really at the edge. And so if you apply these four things, connectivity, validation, orchestration, and monitoring at the edge, we think that they're across all different types of channels that might be coming through. So let's think about a couple of the value points under each one of these. So the idea of connectivity, right? How do we reduce that total cost? You can utilize industry standard tooling, which we talked about in our platform. You can connect different types of communications, right? Different types of connection points. Those are all things that are capable of doing, right? Then really reduce this complexity, right? We have a lot of silos. We have a lot of connection points, right? If you can reduce that, then you can start adding value, right? So managing maybe multiple channels into one, taking mission critical information, putting it onto a platform and managing those mission critical and an infrastructure that will scale. Moving over to the second point, validating. This is really kind of driving data quality, right? So the first would be, do you support, or will the community support standard support for the different types of transactions that you'll be capturing, or the different data sets, right? So is it HIPAA, is it HL7, is it FHIR? What core support is needed because what are you going to be consuming or moving the data in? Then it would be how do I improve first pass rates for the business, for the lines of business, right? Can I streamline these HIPAA transactions? Can I validate not just at that, kind of first SNP level with kind of the structural, but really get into the lines of business validation, ensuring data quality. So this can be used also with clinical edits upfront, right? Member validation and doing exceptions and alerting, all in the sense of making this more interoperable. And then talking about interoperability, right? Moving into orchestration. So CMS has laid the foundation and putting mandates out for these new endpoints, these new API endpoints, right? How do you support those on the same platform that you might be moving EDI transactions and clinical transactions for that? All right. Think about improving partner collaboration, member transparencies, right? All of these things that can, with standard transactions or a standardized extraction, partner management, and these API committees all can be capable. And then finally, monitoring and kind of putting visibility to this is kind of key. If you can't see it right, you can't change it. And so we want to identify issues up front quickly so they can be worked on, maybe even in a self-service capability, but mostly in the idea of upfront early detection, identifying it and making a course correction if necessary, and then identifying these trends, potentially volume increases, so you can put resources where needed at the right time, and it all goes down to data quality in, so you have quality out. And so those are the kind of the four main components and more kind of four value points we want you to understand at the edge. So are we along? Yeah, we're continuing. We already started this. So UHAN, we've already partnered with UHAN, and our implementation teams already have met critical milestones, right? So this is all in the effort to accelerate and really deliver on an interoperability leadership for UHAN. So if you want to think, hopefully some of you already know, we like to put the community value on the left-hand side there, and then a timeline to meeting some of these timelines. So we've already met the data ingest, so onboarding partners, right? We're already kind of routing by using partner IDs and ingesting these services, right? So we're ingesting, right? So phase two, or phase one has already been met for that first milestone. Phase one, the second milestone was adding validation and writing these new rules, right? So we're doing SNP level 1, and then we're adding now into multiple SNP levels, and we're adding that validation up front. That could include member validation, as I mentioned. So these are validation, and we're adding more and more, but the first line has been met. And then we are actually here, still in phase one, but the end of phase one, we're into the transmission and routing services. So good, bad, right? If the data is coming in, like the clearinghouse, right? Data, any bad data is now going to be put into the right spot so it can be worked, reported on, and then hopefully corrected. And then if the correct traffic and the good data is continued to go on. So these routing rules, this orchestration is being adopted and actually put into our products right now. And we're working on those as well. So we're all at the end of phase one. So this is the idea of modernizing that front end, creating automation, creating streamlined processes. And then we're excited about phase two. This phase two is the interoperability, meeting compliance, starting to work with FHIR. Yuhen's team has seen Edifex as a good partner for FHIR, so we actually have the capabilities to actually support most of the FHIR transactions in the endpoint. So interoperability, compliance, looking towards phase two and into the future. So we want to give you an idea of sense of where we're already working and where we're at. John, would you like to talk about contributions?
Thank you, Greg. So what Greg just talked about is earlier this year, Yuhen came to us and engaged us and asked us to put into place an aggressive plan to start out by modernizing the infrastructure, to set them up with a platform that could then allow Yuhen to engage directly with you, the Yuhen community, to figure out, how do we go from here to, infinity and beyond? How do we start with replacing and modernizing, driving down the total cost of operation on the current operation, and how do we set the community up for the future? Like Yuhen, for almost 30 years, Edifex has been evolving with the healthcare community. We've been taking on the challenges with our payer customers, with our provider customers, to meet the needs of information exchange. So when we think about what we're doing with Yuhen, Yuhen is talking to you, the members, the parts of the community, and saying, what is it that you need done now? How can we facilitate? How can we accelerate? So things like partner onboarding, administrative member enrollment, coverage benefits checks, claim submission, kind of all of this meat and potatoes work, and then looking at how do you adopt value-based care? How do you get the relationships and the revenue cycle and the value, the new payment models enabled within the technology environment of the community? How can Yuhen, by collaborating and sharing costs across all of you to capitalize that infrastructure, how can Yuhen do that? And so what Edifex is bringing to the table for Yuhen and for you is, our partner management tools, our member validation and verification, clearinghouse orchestration, all the stuff that really is the day-to-day capability that you need to try to build an information architecture, to build that Amazon platform for exchange among the community, so that you don't each have to capitalize your own edge capability. You can share as much as possible in the middle to drive down costs and to ease the administrative complexity of the capability itself. One good example that we're working on with Yuhen right now, the ability to, as a claim comes in before a payer even gets it, check the eligibility. With integration, with processes, with this platform in the cloud, you can actually hold the claim up, check the member, verify that the member is actually part of that payer, that plan, that health benefit package. And before you even create this useless pathway of submitting the claim and rejecting it, identify up front and make sure that all the information is correct before submission. Garbage in, garbage out. That's been, another cliche of healthcare and technology in general. Those kind of little things that can be done within the space of a platform like Yuhen can create all kinds of value downstream and stop that garbage from getting in and clogging up the downstream systems. So that partnership, that working together, bringing the technology of Edifex to Yuhen, is allowing Yuhen to then come to you and say, what can we do for you tomorrow? So getting to that tomorrow, next slide, please. I think this platform, looking at those cases of taking, the primary stakeholders in terms of providers and payers, and getting that information flowing in that interstitial space between everybody, getting that automated, looking at the various use cases that are coming out of Da Vinci around quality measures, around prior authorization, around all of the stuff that is looked at as the administrative burden, getting that infrastructure tightly woven, evolving into the new emerging FHIR standards so that things are much more efficient, and then working in a way that you will then be able to see where each of you can then bring that and leverage this infrastructure for your consumers. That is really kind of the holy grail of the work we're doing. Next slide. So, to kind of come to a summary, the community use cases and the scalable ecosystem for collaboration, we do this in a modular technology way so that it's easily scalable and can be adopted by the community, in a way that can be done in chunks. so that it's not a huge investment all at once. We have tons of automated mapping tools from our 25 years of experience about taking healthcare data from payers and providers and moving it from one standard to another, 4010, 5010, ICD-9, ICD-10, now, CCDA to FHIR. Those kind of maps that allow us to take the information where it is and use our automated tooling to easily map it without having all these proprietary maps having to be written against your backends. We're finding that to be of great value to a lot of people. Onboarding enforcement, running, anybody can interoperate between one party and another party, or two parties and three other parties. But when you talk about operating at scale among a community like this, you have to be able to govern the interchange. You have to be able to, in real time, as data is in motion, look at what's happening and catch things that aren't going right. And so being able to ensure and automate those standards and engage people, that's a critical capability in any large scalable community. And then supporting any data strategy. We all know that there are people with millions and millions of dollars in their budgets, and people have a challenge bringing together $75,000 to upgrade a component. So having the tooling that we're used to doing for the community at large in the United States and our customers to meet people where they are, meet them at their data capabilities, and then work with UHIN to be able to engage all of its customers, large and small. That was critical, I think, when UHIN talked to us and said, can you help us? And setting this all up so that we can go beyond the mandates and really create value for the community. That concept of, payer or provider or employer as a health value manager on behalf of a consumer, making sure that it's not whether I pay a lot for healthcare or I pay a little, but ensuring that I'm at least getting a dollar's worth of care for a dollar spent. That really is the challenge, I think, that has been escaping us as we've argued about too much or too little. It's really been about how are we making sure that we're getting what we paid for. So with that, Greg, I'll turn it over to you.
That's great, John. Thanks so much. And, this is our last slide, but the concept here is we want you to have a plan. We want to help you any way we can. So, UHIN and NetFX, we're teaming, right, to help you build that plan. Couple of links of note. If you want to build your awareness and some knowledge, we put a couple of links here about, the interoperability, some of the mandates, and also UHIN. So we have actually NetFX and UHIN links here. If you want to start identifying and connecting your systems and your stuff, we have a couple of areas where you can actually you go into some of our products and some of the solutions, right? And then how do we adapt and execute and adapt into the future, talking about machine learning and then potentially some of the grants that UHIN has. But these are all just links so you can start educating yourself more and researching more. And then of course we have our two twins. We didn't see this until we've got the pictures back. Your UHIN contact is Gerald Ashby, Chief Product Officer, and then NetFX contact, Britt Terrell, who the Regional Vice President. So reach out to those two. You have their email addresses. If you have any questions, we're here to help. And then we want to leave you with, if you're not connected, definitely get connected. So thank you so much for your time today.
Thank you, Greg. Thank you, UHIN community.